Medical Rounds, Hartford Healthcare now working on educating the public about the benefits of using something called long-acting injectables for psychosis conditions.
Plus, Hartford Healthcare is also eliminating the barriers for people trying to use these injectables. Doctors have been turning to injectables to help patients who struggle with taking their medicine regularly.
And joining us today to tell us more about it is Dr. Craig Allen, Medical Director and Vice President of Addiction Services at Rushford. Great to be with you again, Dr. Allen. Can you tell us what inspired the shift toward using injectables instead of pills to treat psychosis?
Well, I think it all started with adherence, and it's really important if you want to do well with a disorder that's treated with a medication to actually have that medication in your system. And, that's how it started. What was seen when people started using these long-acting antipsychotics was, adherence was greatly increased over taking oral medications, and people had many, many fewer relapses or returning to those psychotic symptoms, many, many fewer hospitalizations. And when people don't have relapses and they don't have hospitalizations, that means they're able to get back to their baseline, get back with their families, get back to work, get back to school. So these tremendous outcomes of long-acting injectable antipsychotic medication.
That's great. Yeah, I mean, clearly a very positive impact from everything you're telling us. And we wanted to know, how is Hartford Healthcare ensuring the patients and staff are educated on these long-acting injectables?
Well, this is part of it, but there's a work group at the Institute of Living and in the Behavioral Health Network looking at first episode psychosis. First episode psychosis is that very first time someone suffers this very serious and traumatic attack on their brain. There's a psychiatrist who's well known, Henry Nasrallah, who writes, professionals, psychiatrists, medical providers should treat psychotic episodes like medical professionals treat a heart attack. When you have a heart attack, the most important thing when you've had damaged muscles in your heart is not to have another one, and you do everything you can to avoid that. Likewise, with a psychotic episode, there's damage that's done to your brain. But it's that second episode that can really start the trajectory going downwards, loss of white matter, loss of gray matter, and decreased sensitivity and response to some of the medications. So it's really, really important to try and avoid that next episode.
Dr. Craig Allen, we appreciate your time. Medical Director and Vice President of Addiction Services at Rushford. Thank you so much. And for more information, if you're interested, go to hartfordhealthcare.org and look for Rushford under the Location Partners tab. We're back with a final check of your First Alert forecast.